So I'd like to respond to a question that someone posted here on the Optimum Health Clinic YouTube channel around how do you make someone that you love realize that they have chronic fatigue syndrome and or trauma. The first thing I want to say is it's possible that they don't. It's possible that they actually know something that we don't know. Maybe there is a diagnosis they already have or a diagnosis of something else, and they're choosing not to share it. So although I will talk about how we may try to reach that person, it's just important to recognize that sometimes if we feel like we're armed with more information, we can assume we know more than someone else does, and that isn't always the case. Really what I'm saying is one should be incredibly sensitive and careful giving unsolicited advice. Because here's the thing, this is probably what this person is speaking to they've come up against, that denial is a defensive strategy. And so sometimes people are really suffering in their life. And it is clear to us that they are suffering with chronic fatigue or childhood trauma. And the important thing is that we recognize that there are things that they could do to change their experience. Like it doesn't have to be that way, but we can see that they're suffering and there is a defensiveness, a denial, like an unwillingness to talk about it. So if that's the case, firstly helpful, it's just important to see it as that. It's very unlikely it's because this person doesn't care or this person is stupid or doesn't get it. They are defending because there's fear. There's fear of what perhaps a diagnosis might mean, or there's a fear of change, or there's a fear of asking for help. And that defensiveness is a protection against that. Now, if we are going to give some advice and feedback to that person, and it really does feel it is appropriate for us to do that, there's a few different ways that we can go about it. The more challenging way of doing it is to do what one might call an intervention, where we call a meeting with that person or invite them to a conversation. Maybe there's other people we bring into this as well. And there's a very clear, like, you need to see this, you're not seeing this. Now, with an intervention like that, it can be effective, but not done right or not done in the right way with the right person, all it can do is further alienate them. It can actually push that person away. So it's a higher risk strategy. It does have a place, but I think one should be very careful with it. What's often more effective is taking a more medium to long-term approach. But firstly, maybe we become really curious about that defensiveness. Rather than judging, shaming, getting frustrated at that person, we become like, I wonder why that defensiveness is there. And then we may gently and gradually start to feed some different ideas and perspectives to that person. We might send them some things to read, we might drop some things into conversation, and it may well be that that defensiveness is still there, but that doesn't mean that some of what we're saying or sharing isn't sometimes getting through. What sometimes happens is someone's defensive, then they have a desperate moment and they read something and then it opens up. As a stubborn person, I remember when I was first suffering in my mid to late teens with ME chronic fatigue. And in a way, my grandmother was that person with me. She was very into, and in many ways far ahead of her time, we're talking sort of mid-90s here, very into alternative medicine, natural health, and could see that there was a potential for some of these things to help me. But if I was told to do things, I would be defensive. What she started doing was leaving books in strategic locations around the house. One of those books was Louise Hay's You Can Heal Your Life. Another one was Dan Millman's Way of Your Peaceful Warrior. And I was suffering so much day to day and I had so much time on my hands that I found myself picking up and reading these books. And that planted seeds. And although I learned many other things over the years which were different to some of those ideas, they were those initial seeds that were able then to blossom. So one has to find sort of the edge of someone's comfort zone and maybe drop in ideas, maybe give some recommendations, But typically, the harder you push, the harder the other person pushes back, right? You push, they push back. You want to bring in curiosity. You want to bring in gentleness. You want to bring in kindness. The recognition that they're suffering. The more that we become righteous, the more that we know what that person should be doing, all we're doing is ultimately pushing them away. Now, if we've tried this extensively and that person is not engaging, well, what do you do? Well, sometimes what we really have to do is we have to let it go. True love is not loving someone the way we want them to be. True love is loving someone where they are as they are. Sometimes that is the practice, accepting that person where they are, as challenging, as difficult as they can be. But if we maintain that relationship because we're not judging and trying to force things, when that person is in one of those moments of change, like they've had enough the way things are, we have a chance of being the person they reach out to. And then we have the best chance of having a conversation that potentially can help things to change. Watching people we love suffer hurts. Watching people we love suffer potentially unnecessarily hurts even more. But we have to also respect people where they are. Let me know in the comments below this video. Was this video helpful? What's helped you get through to other people? We can all learn from each other's experience. So let me know. And thank you for watching. I hope that's been helpful.